Thank you all for joining us today. And I'm really sorry I'm not going to be able to be there in person to present. So I've recorded the session, my session, which is about embedding quality and patient safety through digital channels in radiology. As we've probably all heard, that patient safety as a discipline has been a global health priority, is gaining maintenance in the past few decades. And of course, the pandemic was what pushed it a little bit. But since then, it's been taking the limelight. And it's because embedding healthcare quality through digital channels improves patient outcomes, increases access to care, and reduces costs. And for this to materials, we all need a strategy, we need standards, or we also needed a well-rounded education and a culture of sharing best practices and an appetite for collaboration and innovation. And I think this is why we're all gathered here to do all those things. So I have nothing to disclose. And so today we're going to have an introduction about digital transformation in radiology. We'll talk about quality assurance through digital tools. And then we'll talk about some patient safety enhancements. We'll talk a little bit about challenges and consideration and the future directions and conclusions. So 90% in the bar exam, 88% in LSAT, GPT-4 beats 90% of humans in the world's toughest exams. Here you can see the performance of GPT-4 in comparison, and that's what you see in dark green, in comparison to the purple, which is the average student. So it has really surpassed the average student. And more so. Starry night. Okay, so I don't know if any of you recognize this music, but when I was putting this conference slides together, I was thinking that I would use ChatGPT to generate some art for this conference. And from the music, you can tell this is a Starry, Starry Night. This is one of Van Gogh's famous paintings. And I combined that with the digital thing for patient safety and a picture of our hospital. So as you can see, generative AI is even in places that we never thought it would actually go into, like generative stuff and creative stuff. So I'm sure you've all heard of To Err is Human, and 44,000 to 98,000 patients die every year from medical errors. And the Journal of Patient Safety also states that such a large number each year suffer from preventive harm that contributes to its health. Some numbers show that 1/3 of hospital patients admitted are some sort of medical error, and almost 70% of the 1.7 million hospital-acquired infections could be prevented. So, and surprisingly, between 2010 to 14, surgeons operated on the wrong body part almost 2,413 times. So these are alarming statistics about patient safety. I'll just go through a few of the well-known cases. So here you see Dari. Dari underwent an unneeded double mastectomy because a patient actually mislabeled a sample, and she never even did have cancer. Meet Sebastian. At only 3 years old, he was a happy boy who was a little bit short for his age. So his parents took him for a routine test for what they thought was going to be a growth hormone test. And then he ended up getting 10 times the amount of arginine for that test and ended up with cerebral edema and passed away. So this is a family wrong twice. Pat and Sue Sheridan, whose family has been forever affected. So Cal, the child there in 1995 had physical evidence of jaundice when he was born, and he was told that was nothing that they needed to worry about. But then that jaundice led to severe cerebral palsy after that. And his father, Pat, who died at the age of 45 from cancer, they found a mass which was previously mistaken as and reported as benign was actually cancerous. And the scan showed evidence of a malignant synovial sarcoma, which was misread. This little girl, Josie, Well, Josie here, King was admitted to the hospital with some burns. However, she's supposed to be there only for a couple of weeks. And one thing happened after other, and she ended up with an undetected central line infection and dehydration and also passed away. So these are very well-known cases of patient mistakes. And these are just the ones that we know about. These are happening every single day. So we all say, why digital channels? So today we're saying that around 404 in the US, 440,000 Americans die to medical mistakes. And it ranks the third cause of death after cancer and heart disease. So tell me, would you get on a plane if I told you that every day, 2 to 3 flights, big jetliners crash? Would you get on that plane? Well, this is how safe our healthcare is. So I don't know if you all remember Captain Sullenberger. He's the one who actually landed the jet on the Hudson River. Well, he compares aviation with patient safety. So we all know and the differences between them. So there is a little bit of difference because when you're in a jet plane, it's one big crash. But with healthcare and medical mistakes, it's one patient at a time, one family at a time. So there's a little difference. And then what happens when a plane crashes? So when a plane crashes, everybody goes in, they try to find the root cause, and then they educate and go back and train the pilots and the crew so this never happens again. And they fix the root causes. How often, we ask ourselves, do we do that in healthcare? So I think these are a little bit, this is one of the differences. And when we're saying down here, influencing behavior at the sharp end is pooling the people, the processes, the people, including the culture, structure, the processes like policy and protocols, and lastly, but importantly, the technology. And today we're going to say how we can leverage that technology. So this is the promise of technology to reduce harm. And these are some things that we're going to look at. And we have to balance that digital clinical safety strategy. And so we have to balance the extrinsic ability of technologies to drive safety, as well as the intrinsic safety of those technologies, because we also want to make sure that what we implement is very safe. So the benefits of digital channels in radiology and their impact. So here's a few things that they can do. So we have improved accuracy through AI and machine learning, standardization. We have increased efficiency with automated report and decision support, faster turnaround time, so we're not waiting a long time and for a patient that has to get the result. And enhanced communication, improving interdisciplinary cooperation and patient engagement. We also have cost saving as a byproduct and with reduced operational costs and optimized resource utilization, which means we can actually put our resources to do more things. And then with data analytics and continuous improvement, we have quality control and improvement programs, and we also have predictive analytics. So the role of digital channels and radiology and their impact. So in terms of support for remote consultations, improved diagnostic accuracy, enhanced workflow efficiency, and real-time access to information. And we're going to talk about all these in a little while. So starting with AI machine learning. So we're all, of course, all of us are aware with AI machine learning come in with both enhanced diagnostic accuracy through pattern recognition and image analysis with consistency and standardization. The second thing is reduction of human error, assistance with complex cases, and real-time alerts and notifications. And especially when you can have images that we can use AI and machine learning to pull up the images into the workflow that need to be read ahead of time because there might be some abnormality in it. And then we have, of course, decision support with clinical decision support systems and risk stratification and predictive analytics. In terms of digital imaging, we have improved image management through centralized image storage and secure data access, enhanced image retrieval with instant access to historical data and integration with electronic health records. We have improved image quality and processing. We'll talk about some of those tools right now with advanced image processing tools and support for multiple modalities. And then in terms of workflow automation with speech recognition and structured reporting, now even with ambient coming in with that generative AI that can do a lot of the stuff with pre-populated, well, no longer for pre-populated templates and autofill features because you can automatically get Gen AI to do that. We have the second thing is the automated task management with work list management and task assignments and alerts and error reduction tools with decision support and error checking automatic quality QA checks. So, we, of course, I mean, all these are going to lead to improve accuracy, efficiency, communication, cost saving, and data analytics and continuous improvement, as we saw. So here are some of the technologies that can be used to improve patient safety in radiology, and we'll go through some of the examples that we saw out here. So tools such as clinical decision support systems, radiation dose management systems, and clinical decision alerts, these are going to play a pivotal role in improving patient safety and reducing harm, and having those timely interventions to be able to get to the patients and needed time to prevent these occurrences from happening. So clinical decision support systems with real-time integration with electronic health records, evidence-based guidelines coming in, error reductions with automated checks and balances and AI-driven diagnostic assistance, and enhanced communication with real-time decision support alerts. So when we talk about some of those real-time information access, other than the integration, even at the level of the clinician when they're ordering, in terms of smartly assisting the clinicians to order the right modality for the diagnosis, because that would help also to bring the right decision, the right sort of radiology test or imaging test to the clinician. In terms of workflow and using AI-powered workflow for imaging, we have tools that help with setting acquisition parameters, assessing image quality, and pre-processing and hanging images for interpretation, the protocols, and maximizes image quality by reconstructing images. Here's an example of the Philips Smart Speed software for reconstruction in an MRI. And here's another one here with Subtle Medical, in which Subtle MR reduces the image noise and helps decrease the acquisition time. And here's an example from from almost 2 minutes to 42 seconds. And also here is the same thing similarly for the PET scan, and that also improves the image quality. And also reducing the time from 24 minutes to 6 minutes. Here's another one right here with case triage, and this is with AI prioritization of workflow with image analysis, quantifying lesions on previous and current scans to help also the radiologist read it. AI application for triaging, work list assignment, pathways, and workflow orchestration, flagging urgent cases for prioritization, and alerts to the radiologist about urgent cases, so we can actually pull those ahead of time and have a pre-read about them. And then coming soon, which is the NLP and AI shaping the approach to workflow and diagnosis, because with natural language processing and we're seeing generative AI come in really big here. That is going to really rechange the way that we actually do the readings and even the way we approach our workflow with that intelligence coming in. Here we also have computer-aided detection, diagnosis, and decision support tools in assisting in detection, identifying patterns, and even in predicting disease progression over time. So we have detection and we have characterization with segmentation, detection of boundaries of an abnormality for diagnostic and treatment planning, and diagnosis for helping the diagnosis via benign versus malignant, and even with the tumor TNM staging. And we also have monitoring and change analysis for treatment response. And these are all coming embedded as content and through machine learning and others to be able to assist in, of course, detection, identifying patterns, and predicting disease. The more these algorithms are fed, the more smarter they'll become. Eventually, when they're going to have the minds of all of us, and they will be probably better than us to predict all these abnormalities. In terms of automated workflows and efficiency, here's an example of Philips Vital Eye technology and algorithms that process over 100 body locations in parallel to intelligently extracts signs of breathing, allowing routine exam and setup time to occur in less than a minute. Here we have an example of automated workflows and efficiency with GE Healthcare, with this effortless workflow that uses AI and machine learning tools to automatically assign and suggest protocols for each exam. Also position the patient in a scanner, provide the correct range for head, chest, abdomen, and pelvis scans, and of course, post-scanning image review and analysis all in one. And it's streamlined into this effortless workflow. Automated workflow and efficiency in natural language processing. I mean, we've seen Nuance and other ones come up with their AI-powered platform integrating directly in the radiology workflow. But now we see more and more taking it one step more with basically based on the radiology images suggested actually reports. It can also analyze if you load up also the previous images, and give you actually over time how things have changed, how things have changed. And with a lot of these newer technologies, you're getting a lot of even auto coding and even with robotic process automation, you're able to instead of having to manually put in alerts or and tags, it's actually auto tagging them for you and then verifying those tags. In terms of radiation dose management, there is both monitoring of radiation dose exposure with automated dose tracking, real-time dose alerts, optimizing image protocols with personalized dose optimization, protocol standardization and compliance, and then, of course, with reporting and analytics, you're getting data-driven insights based on those automated dose reports. And nowadays, a lot of this can be automated, cumulated over time, and interacted through all the historical, especially as you move into the era of health information exchange, and you're able to pull in other scans that have been done elsewhere. This will also help you help put all that together. In terms of clinical decision alerts, of course, through AI machine learning, immediate notification of critical findings. You can also have robotic process automation and happen and different pathways depending on the case, and of course, automated escalation protocols. And then suggestions for follow-up appointments. Also through RPA, you can have automated follow-up reminders and with radiology specific alerts based on the workflow, because you might want to do a reflex test after a certain time. And then streamline communication through interdepartmental alerts and integration with mobile devices. Again, RPA can be utilized through any system to do that. And then here we have an example of analytics and risk assessment with coronary computerized tomography and angiography measuring atherosclerosis. And here's one of the technology called Clearly, which is an AI digital based platform with what uses CCTA imaging to measure atherosclerosis. It's an indirect marker for risk factors and symptoms of disease, and to offer a more simpler, faster, and accurate heart disease evaluation. Here's another one with multimodal AI fitting into multi-omics. And now, because clinicians nowadays are faced with increasingly complex data sets, not only radiology information, but genomic data, pathology reports, blood analysis, And putting all that together, especially in the in oncology, is very difficult. So here's an example from Sophia Genetics, which combines radiomics with genomics for oncology. There's a lot of tools out there right now that are putting all these different images from the different packs together to come up, and including also genomics on top of that, to help more aided and more accurate diagnostics. Trying to get into that personalized medicine space and precision medicine. So let's talk about adoption, how to leverage these technologies safely and efficiently. So most radiologists right now are at the point today where they don't believe that the AI solution are replacing what radiologists do, but instead see that this could potentially make them more efficient. That is the way of reducing workload, and it can be a second check or a second reader. So I think this is long gone are the days that radiologists are actually questioning these technologies and saying that AI and machine learning is something unsafe. But there are some challenges, of course, as we're all aware. There's a lack of high quality, high volume, longitudinal outcomes. There is challenges, as we all know, associated with the curation and labeling of medical imaging data. And this is what's probably keeping us really behind and not progressing as fast as we can. Of course, there's regulatory approval to ensure the representatives of the data sets, and as well as patient privacy. I think at least in Saudi Arabia, FDA, Saudi FDA approval is required for algorithms if they're going to be used for diagnostics. And this has been a challenge right now to obtain those regulatory approvals. So what are some of the challenges that we're seeing with medical AI? So first of all, there's the challenges to obtain those large data sets labeled and also agreeing on the ground truth. There's compatibility and privacy and data sharing and lack of federated learning. And then because there's a lot of issues with data sharing, a lot of organizations do not want to share with each other. And then after that also, a solution would be federated learning, in which somebody puts out an algorithm. Organizations make changes in the algorithm, so they never share their data. And then basically they send that algorithm back. The central entity collects all those algorithms together, and based on that, puts out a new algorithm, and it keeps on going through that federated learning cycle. And there's also the backbox problem, especially with, this is not only related to radiology, but any AI. And the situation is when a private, they don't, like the clinician doesn't know how the AI algorithm came up with that solution. So with confidence. So again, so that is that black box problem. We also have brittleness, and because AI algorithm can be brittle. So training the data set to detect pneumonia or breast cancer successfully at one hospital doesn't mean it will work in the other. So you always need to do a trial on the algorithm to make sure it will work. Of course, there is cybersecurity and adversarial attack when hackers can infiltrate a PACS and cause problems. There are legal implications. So if AI makes a mistake, who will be responsible? The AI company, the radiologist, the hospital, or the person who made the purchasing decision? So these are still unclear. And there's usability and unintentional bias of how the model was trained, what type of data set was used, whether or not it had FDA clearance, how well it's integrated into the workflow, and whether any institution has piloted it with real-world results. And these are the kind of questions you want to be asking yourself anytime you go out and buy one of those off-the-shelf models, or if you're using a model. Of course, there are ethical issues of AI impacting the human-machine relationship and human civilization. As these continue to develop, they increase the productivity of people who control and use these tools. So it's very important to make sure that there is no bias across them. It's very hard to stop bias. AI will replace many times and labor-intensive aspects of imaging work. Of course, this is going to be freeing up time and energy for higher level tasks, so everybody's functioning at the top of their license. And as we learn how to use AI, we must ensure that we also learn how to implement it properly to avoid ethical issues like data ownership, access, profit, true anonymization, and privacy, and data bias to determine the ground truth, whether overfitting selection, bias, data shift, data set shift, situation bias, and self-classification. And then we talked about black boxes, transparency, interoperability, and explainability. And I'll leave these in the slide for you, but these are how to evaluate AI algorithms, validation, and performance. And there's a few suggestions here. And again, we have to balance the extrinsic ability of these technologies to drive safely with the intrinsic safety of these technologies. And through that proper evaluation, you'll be able to balance that, to make sure that do no harm. And of course, to balance it with regulatory compliance and patient safety, continuous engagement with stakeholders, co-ideation with frontliners, looking at startups and networking to see what's out there in terms of newer innovations, prioritize patient safety and security, promote a culture of innovation, and establish transparency and understand risks anytime you're going for more innovations within the radiology workflow. And then once you get ready to implement them, conduct your risk assessments, prioritize user safety centered design, conduct usability testing, cybersecurity and privacy by design, not as an afterthought, provide training and education, and continuously monitoring technology because things change, and so you need to always ensure that they are safe. So let us all embrace a sustainable future in healthcare. Together, we can create a sustainable healthcare ecosystem that nurtures innovation, compassion, and the well-being of individuals and our planet. So definitely let's embrace all these new digital technologies that are coming out whilst ensuring patient safety. Thank you very much.